Chapter 56 Men's Reproductive Disorders. The male reproductive system. It's very involved with hormonal regulation as well as functioning, sexual function, and disorders usually revolve around things like hypogonadism or delayed adolescent puberty. Some drugs related to male reproductive disorders would be testosterone. This controls both the development as well as maintenance of sexual prowesses, the accessory sexual organs, cell metabolism, and bone and muscle growth. Indicated for things like androgen deficiency, hypogonadism, replacement therapy, and delayed puberty. There is a long list of side effects from testosterone. Everything from priapism, gynecomastia, GI distress, insomnia, injection site reactions, increased or decreased sexual desire, hypercalcemia, muscle cramps, baldness, weakness, confusion, changes in skin color, or headaches, just to name a few. When taking testosterone, it can have many interactions as well. Everything from oral anticoagulants, parathyroid hormones, calcitonin, anti-diabetic agents, corticosteroids, and barbiturates. Caution in cases of hypertension, coronary artery disease, seizures, hypercholesterolemia, renal disease, as well as with infants, children, and older men. It's also contraindicated in cases of pregnancy, nephrosis, or nephrotic phase of nephritis, hypercalcemia, pituitary insufficiency, hepatic dysfunction, BPH, prostate cancer, history of myocardial infarction, or men with breast cancer. Anabolic steroids. These are a class of steroid hormone related to testosterone, and they work to increase protein synthesis within the cells, resulting in anabolism, especially within the muscles. And this is where the development and maintenance of those bigger muscles come from in the case of like those, if you remember the steroid era of baseball in the 90s. Testosterone precursors. These are available as nutritional supplements and include adverse effects ranging from increased weight and body size, acne, mood and behavioral changes, aggression, increases LDL proteins, decrease HDL proteins, hypertension, liver damage, and cardiac structural changes. We want to keep a careful eye on everything from monitoring weight, blood pressure, liver and thyroid function, as well as blood lab results. You should also assess the patient's affect during therapy. Advise the patient that an intermittent approach to therapy allows for monitoring of their endocrine status. You should also encourage the patient to closely monitor their muscle strength and urge men undergoing androgen therapy to report any priapism promptly. Or anti-androgens, these block the synthesis and action of androgens. Used in cases of benign prostatic hypertrophy, advanced prostate cancer, endometriosis, male baldness patterns, acne, hirsutism, and viralization syndrome in women. Other male reproductive disorders include things like testicular enlargement, penile growth, pubic hair development that has not begun by age 14, and would again be treated with testosterone. In the case of BPH, glandular units within the prostate gland undergo tissue hyperplasia with aging. Symptoms would include a bladder fullness sensation, frequency, nocturia, hesitation, dribbling, and erectile dysfunction. Malignant tumors, these are adenocarcinomas, metastasis to lymph nodes, bone, lungs, liver, and adrenal glands, and treated with a combination of surgical resection, cryotherapy, anti-androgens, radiation, chemo, and pain management. For our first practice question, a nurse teaches a patient that sildenafil is contraindicated for patients taking which category of medication? That be A, sulfonylureas, B, beta blockers, C, nitrates, or D, proton pump inhibitors. And that answer is going to be C, nitrates. Nitrates are massive vasodilators, just like sildenafil is also a vasodilator, and you never want to combine the both for risk of critical hypotension. Or practice question 2. A patient receives androgen therapy for hypogonadism. The nurse teaches the patient to observe for common side effects of the drug, including which of the following: A, abdominal pain and hives at the injection site, B, dry mouth and hyperhidrosis, C, weight gain and blurred vision, or D, generalized rash. And that answer is going to be A, abdominal pain and hives at the injection site. For practice question 3, the nurse should inform a woman undergoing androgen therapy that she may develop which symptom? A. Impaired bone growth. B. Gynecomastia. C. Vocal changes. Or D. Priapism. That answer is going to be C. Vocal changes. Practice question 4. Before administering androgen therapy, the nurse must know that this is contraindicated in which of the following? A. Chronic obstructive pulmonary disease. B. Diabetes mellitus. C. Pregnancy. Or D. Serum calcium of 8.0. And that answer is C. Pregnancy. But anyway, that's all we got for this chapter. I'll see you in the next slides.